What's up, y'all? Short, quick, efficient video about varicose veins. We got this question the other day inside of our Blueprint membership, and I wanted to make a video so it's more permanent. You can come to it. What exactly are varicose veins? So they are enlarged, sometimes twisted veins, and they appear dark blue, dark purple. They might resemble cords like going down the leg. Some people call them spider veins because they have the long legs. But most common location in pregnancy is legs and also the left labia. They occur where the valves in the veins have become weak or damaged, like they've lost that elasticity, and that allows the blood to pool in that area instead of efficiently going back up to the heart. So arteries carry blood away, veins carry blood back to the heart. They can develop anywhere, but the legs and feet are the most common. And like I said, in pregnancy, the most common area I've seen is, yes, the legs and the left labia, which is not exactly comfortable, y'all. Like with the women that have this, it is like annoying. So I know it's, oh, you want to do something about it. Um, like I said, the veins become weakened, and it's usually like there could be a family history. Women have a higher risk factor than men. Age decreases the elasticity within the veins. So those are all risk factors. If you were obese coming into pregnancy or overweight, that's definitely going to have a risk factor. Hormonal changes, that has a big kind of input, which is why women experience varicose veins more often than men. And, as the uterus grows, that's going to put some pressure on those veins inside the pelvic bowl as well. And it's going to, the baby's growing, we're gaining weight. So that's also going to put a little pressure on there. So those are some things that kind of like add up to the perfect storm of varicose veins. Also, couple that with if you're standing for long periods of time or sitting, like maybe you have a job where you sit at a computer or you work a 12-hour nurse shift or something, you're in one position for a long period of time, that's definitely going to contribute to varicose veins. Maybe you have a history of a leg injury, surgery, something that could contribute, history of blood clots or like legit constipation, that all can contribute as well. So moving forward, lifestyle changes, definitely stay moving. Like do not sit for a long period of time, y'all. Like if you have to be on your feet for your job, maybe every hour, go put your feet up the wall, like lay on the ground, booty against the wall so that your legs can go straight up the wall. That would be so helpful. 2 minutes, 5 minutes, every 30 minutes, every hour. If you're sitting, get up, do some calf pumps, like calf raises, 20, 30 of those, do 10 squats. That's going to help you so much. Avoid crossing your legs, avoid things like high heels, super tight clothing, super heavy lifting. Like, yes, I love heavy lifting, but not the heaviest lifting when you're in pregnancy, because if you have to hold your breath and you're pushing down, that's kind of like you're trying to bear down for the constipation, like same category as constipation. So stay moving, stay regular exercise, regular movement. That's going to be like so good for you. Elevate your legs multiple times a day, wear compression stockings or tights if you need to. Stay hydrated. That's going to be super key, super key. And then, eat real foods that have fiber, flavonoids. Vitamin C is great for collagen, even taking collagen. Like I love Bub's collagen. That's going to help. Vitamin E is great for preventing blood clots. And overall, it's just an awesome vitamin. And then if you want some herbal remedies, be sure to check out Butcher's Broom. That's going to increase circulation and strengthen the blood vessels. It's going to improve overall. Grapeseed extract tends to be a good option as well because it contains antioxidants and also may benefit vein health. Horse chestnut contains a product called aciin, and that may strengthen the walls of the veins. And then you can also take some witch hazel, make a compress, and put it directly on the situation, on the labia, wherever, and that can bring some temporary relief and temporarily tighten the skin as well. One other thing I love to send home is, Do the Big Six by Perry Nicholson. And that's really getting the lymphatics going. And you can do it in less than 90 seconds. So all you're doing is gently rubbing these 6 areas, the collarbone. Yeah. And you can go in circles. He calls it the upper neck, but I call it the ears. Get here. And I usually do like 6 to 10 motions. And then get the armpits, right? Because sometimes patting is nice. Or just going in this. Ooh, ooh. So good, huh? And you're really going to feel good afterwards because you're shifting energy. Then the abdomen, right above the belly, right around the belly. There's a bunch of lymph that hangs out in this space. You can pat it if that feels good. And then the groin, both groin areas. And then behind the knees. I know you can't see that, but behind the knees. Those are the big 6 areas. And if you can't get in for a lymph massage with somebody great, do that. Do that every morning and every evening. And then if you want to get a little more quantum with me, scalar wave therapy is awesome to help promote healing on the cellular level. I have a device called the Healy. You might work with a practitioner that has different devices, but I love my Healy. If you ever want to invest in a Healy, definitely let me know. I can give you my codes. Intention, like know that you can heal and put that out there. Visualize your body healing. When you're meditating, when you're praying, thank God for your body's adaptability, your body's ability to heal. And then, yes, I mentioned lymph massage, Reiki. Be sure you're getting chiropractic adjustments. Acupuncture can help, and even sound therapy. If you are curious, like when is it appropriate to seek outside medical help? Your intuition will tell you, I promise. But if there's any sort of inkling of an infection, swelling, redness, warmth, maybe you have a temperature, if it's just so heavy and severe and persistent pain and discomfort, that might be an option. Like that might be a symptom for you to go seek medical help. But in general, y'all, these lifestyle changes, the big 6, those can go a long, long way. And the last thing I'll mention is, something like rock tape or kinesio tape, which is designed to work with the surface receptors of the skin. Sometimes just putting that down the legs can really help. But the big 6, like get that going daily. Because I've seen that work wonders, and it takes less than 90 seconds. So if you have any questions about varicose veins, let me know. I know they're not comfortable. I know they're kind of a pain in the labia, but I've also seen them heal during pregnancy and diminish during pregnancy. So best of luck to you.